Good morning. I'm very pleased to be here today to highlight my first private member's bill, Bill 141, the Defibrillator Registration and Public Access Act, which will be debated this afternoon at second reading. I am convinced that this legislation will make an important difference in the lives of Ontario's residents and will literally save lives. I am joined here today by a number of representatives from Cardiac Arrest Response and Education, or CARE, and I want to specifically recognize Dr. Catherine Allen and Roberta Scott, who will be taking the podium in just a few minutes. Are also lucky to be joined this morning by Will Jones, a cardiac arrest survivor who is here to share his story. And finally, I want to recognize the support of Heart and Stroke, who also has representatives here this morning. As I said, this bill is about saving lives, ensuring that those Ontarians facing a sudden cardiac arrest, which is a sudden stoppage of the heart due to an abnormal heart rhythm, have the best chance to live and the best possible chance for a full outcome, full recovery. In the province of Ontario, we know that there are 7,000 cases of sudden cardiac arrest each year. In the City of Toronto alone, there are 500 or more per year that occur in a public place. Overall, 85% of cardiac arrests happen outside of hospital. The only treatment is a life-saving electrical shock from a defibrillator, like this one, administered along with CPR. But as everyone knows, in the case of sudden cardiac arrest, time is of the essence. For every minute lost without medical intervention, the survival rate for a sudden cardiac arrest drops 7 to 10%. Often, when there is a sudden cardiac arrest, 911 is called, and the paramedics arrive on the scene. Unfortunately, despite heroic efforts from our first responders, it is often too late to help someone or to ensure a good outcome. The survival rate is about 10%, and clearly that is not great. But if a bystander is there and applies a defibrillator within minutes, the victim can be saved in more than 50% of the cases. Unfortunately, automated external defibrillators are seldom used, in about 3% of cases, and often because bystanders do not know where they are, cannot find them, or they are not easily accessible. One of the best ways that we can fix that problem is to connect our 911 dispatchers with a registry that would allow them to guide members of the public to the closest accessible defibrillator. This legislation also introduces mandatory accessibility, inspection, and maintenance requirements for the owners of automated external defibrillators, which are located in public places. These measures will ensure that defibrillators can be easily located with adequate signage and are not kept hidden away or behind lock and key in some cabinet. And it will also ensure that they are in working order so that they can be relied on at all times when every minute counts. It also gives me, the Minister of Health in our ministry there, the authority to designate types of public premises where the owner of the facility would be required to install an automated external defibrillator, should it be deemed necessary. So I'm going to invite now Dr. Allen and Roberta Scott up to the podium to make a few remarks on behalf of CARE.
Thank you, MPP Martin. So, good morning. My name is Dr. Catherine Allen, and I am Chair of CARE, Cardiac Arrest Response and Education, a grassroots organization that is based in Ontario. Our group is made up of patients like Will Jones who have survived a cardiac arrest. It is also made up of parents who have lost children to sudden cardiac arrest. We also have scientists like myself and clinicians who are experts in the field, along with 5 paramedic organizations including Toronto, Peel, York, Halton, and County Simcoe. Together with Heart and Stroke Foundation, our mission is to save more lives by creating awareness of sudden cardiac arrest, teaching our children how to save a life, and making AEDs more accessible. We are thrilled about the private members bill introduced by MPP Martin that mandates the creation of an Ontario registry for automated external defibrillators, or AEDs. AEDs save lives and can triple the chances of a person surviving from sudden cardiac arrest. The problem is that most people don't know what they are or where to find them. Having a complete registry of all sudden cardiac arrests in Ontario, of all AEDs in Ontario, would be a large step to improving how often people use them and will ultimately save lives. At present, AED registration in Ontario is voluntary. In the Greater Toronto Area, approximately 1,500 are registered, which is less than 10% of the total that have been sold in the past 20 years. As such, we believe that mandatory registration is the only solution. This legislation will ensure that all registered AEDs will be clearly displayed, in working order, and be available to the public without being locked up or inaccessible. This registry will be available to both the public and EMS agencies so that 911 can tell bystanders exactly where the AED is located. We are grateful for MPP Martin's leadership and effort on this critical public health initiative. We look forward to supporting her in the legislature this afternoon and to working with her office on this important issue. Any heart can stop suddenly, but together we can restart some of them. Thank you.
Hello, my name is Roberta Scott, and for 32 years I worked as an advanced care paramedic in the City of Toronto. I'm also a volunteer on the committee called CARE, Cardiac Arrest Response and Education. Paramedics across Ontario respond to thousands of sudden cardiac arrest emergencies every year. We are highly trained professionals who have a wide range of medical directives to treat and resuscitate victims of all ages who have experienced a sudden cardiac arrest. However, we are only one link in the chain of survival, and one of the other most important links to improve a victim's chance of survival after a cardiac arrest depends on all of you. Every single person in every community across this province has a vital role to play to help us save lives. And that is the ability to quickly recognize the signs of a cardiac arrest and to initiate CPR and the use of an AED, automatic external defibrillator. These simple life-saving steps taken by the public can potentially increase the chances of survival by at least 50%. But right now in the EMS and medical community, we have a problem. In cardiac arrests, AEDs are used only about 2% of cases. And for every 1 minute delay in defibrillation, with an AED, the survival of a cardiac arrest victim decreases by 7 to 10%. We can do better. You can do better. And together, as we work to solve this problem, more people will survive to be with their families, friends, and loved ones again. This is why I am so honored to be here today to commend and support MPP Robin Martin, whose private member's bill is aimed to take a huge leap in helping save more lives. Her bill to create a provincial AED registry will undoubtedly be a major step towards our goals of increasing the survival rates for thousands of sudden cardiac arrest victims. When the location of all AEDs are readily accessible to public and EMS agencies, their use will increase, and therefore increasing survival rates. Paramedics need your help. We need all of you to know where the nearest AED is and to use it quickly, along with the effective CPR, and this will ensure that when we arrive at the scene, all of our resuscitation efforts will be maximized, and we will have the best chance of saving your loved ones, friends, and family members. MPP Robin Martin's bill for an Ontario AED registry is truly a life-saving one, and paramedics across Ontario salute and thank her for taking on this important issue. This is a bill with heart, and it will make a difference. Thank you.
Thank you very much to both of you. During the time that I spent working on this legislation and meeting with stakeholders, I was moved by many of the stories of individuals who have had their lives saved thanks to a quick intervention from bystanders or first responders following a cardiac arrest. And with that, I would like to invite Will Jones to say a few words about his own personal experience and his advocacy on this very important issue. Will?
Thank you. Thank you. So back in 2004, I suffered a cardiac arrest in high school. The teacher was quick thinking and saved my life with CPR, and firefighters came with an AED and shocked my heart and brought me back to life. Since then, I've experienced another 17 years of life, of memories with my family, my friends, going to university, starting a career, and I'm so thankful to be here with MPP Robin Martin and the Heart and Stroke Foundation and the CARE organization, because this bill will save more lives and save more fathers, mothers, sons, daughters, and I look forward to meeting them in the future, and I'm so happy to be here. Thank you so much.
Thank you, Will. I'm very excited to be bringing this legislation forward to the House, and I hope all parties will be able to find common ground on this important measure. And with that, I think we're done. Thank you.